The applied laser technology DIODOPP gives clinicians and scientists an easy-to-handle, compact instrument for the continuous and reliable monitoring of skin blood flow and other microvascular perfusions. The heart of the system is the unique measuring probe in which a small laser diode, 2 diode photodetectors and preamplifiers are integrated in a hybrid circuit. This eliminates the fibre movement sensitivity problem which affects all laser Doppler instruments using optical fibres. The laser Doppler technique is a completely harmless, non-invasive method giving a sensitive, instantaneous linear response to skin blood flow changes. Although laser Doppler devices cannot measure absolute blood flow, the DIODOPP probe and its unusually large measuring area gives an accurate representation of the changes in the average regional blood flow in skin tissue. The probe can be easily attached to the skin with double-sided adhesive rings, and even for long-term monitoring does not need any change to the measuring site. Direct reading of the microvascular blood flow in the tissue volume being monitored is provided by the DIODOPP's liquid crystal display and the built-in line recorder. A rear panel BNC connector provides a 0 to 1 volt signal directly proportional to the measured reading, suitable for external recorders or computer processing. A range of probe holders for special applications are available, as well as an iontophoresis application pack containing a special probe holder, 3 iontophoresis test agents and syringe.
In principle, the monochromatic light from the laser diode penetrates the skin where it is absorbed and scattered. The part of the light which is scattered by the moving red blood cells undergoes a slight frequency shift due to the Doppler effect. The Doppler signal is determined by the number of red cells and their velocities in the measuring volume, and the reflected laser light is registered by the laser Doppler Velocimeter probe, whereby output voltage is proportional to the velocity and number of moving red cells. The clinical applications are many, but are based upon the integrity of the microvessels in the skin or tissue being perfused. The endothelium lines the luminal surface of blood vessels and comprises a single layer of squamous cells, and it is these cells which are thought in part to modulate the peripheral blood flow. Abnormalities in the endothelial cells can result in disturbances of skin blood flow regulation. The DIODOPP laser Doppler Velocimeter may be used to examine the integrity of the blood vessels by measuring the responses of smaller skin vessels to various stimuli. When the following series of tests are applied in sequence, then information can be obtained about the functional state of all 3 elements in the skin's protective neurovascular cascade. Firstly, the smallest C nerve fibres of the pain sensory pathway and their receptors. Secondly, the responsiveness of the microvascular endothelium. And finally, the reactivity of the vascular smooth muscle. The first element in the cascade is tested by the chemically evoked axon reflex test. The chemical test of C nociceptive sensory nerve function involves iontophoretic application of acetylcholine sufficient to produce a radially spreading axon reflex flash. This is measured by the DIODOPP probe located in the center of the ring chamber. This chamber is applied and held firmly onto the hairy skin to be tested, for example, the forearm or the foot dorsum, and is fastened by the attachment bands. The indifferent electrode gauze cover is dampened with water and is then attached to the wrist or the ankle. Several minutes of DIODOPP resting flux are recorded. During this time, the acetylcholine chloride 2% solution is freshly prepared by mixing the distilled water and acetylcholine powder and is drawn into a syringe. The acetylcholine solution is injected into the ring chamber until a drop overflows, and then both the indifferent electrode, the cathode, and the chamber electrode, the anode, are connected to the iontophoretic current-passing device. The 200 millicoulomb setting is selected, and then the current is passed. From the end of current application, 6 minutes of flux recording is continued to ensure that the maximum extent of chemically evoked axon reflex flash is recorded. This same procedure is followed for testing the second and third elements of the cascade, but using pilocarpine or sodium nitroprusside as the chemical agents. Measurement and interpretation of flux responses are described in the handbook. Apart from measuring neurovascular function, one other particular use is in plastic surgery. Here it is possible to monitor the revascularization of skin flap. The DIODOPP is able to measure a series of flux changes in the pedicle as a result of venous obstruction and its release, or arterial occlusion and its release. Many other clinical applications are described in the brochure.
Apart from any aesthetic qualities, the skin has 4 functions: fluid maintenance, temperature regulation, it is a rich sensory organ, and it provides excellent protection against infection. In this program, we will be concerned with the role of the thinnest skin nerve fibres in the last 2 of these functions, that is, sensation and protection. The present vignette will describe some recently developed techniques for measuring neurogenic inflammation and for assessing the function of the smallest cutaneous nerve fibres. It will also explain the neurovascular bases of these tests and the principles of operation of the DIODOPP laser Doppler Velocimeter used to measure blood flow changes. When we are injured, whether it be a cut, a burn, or an insect sting, a certain number of phenomena are observed at the level of the wound itself. Firstly, pain is felt when the site of the injury grows hot and red, swells, and in the case of a burn, a blister then forms. Subsequently, everything rapidly returns to normal without complications, and if it is a wound, the tissue heals. These phenomena cover a series of very complex cellular and vascular reactions which have been investigated since the last century. Any noxious stimuli, whether electrical, chemical, mechanical or heat, are able to excite skin sensory receptors of the polymodal C-type. These give rise to sensations of prickle, itch or pain. These primary afferent nerves contain and release peptides such as substance P, calcitonin gene-related peptide and others. These peptides are neurotransmitters at central synapses and are powerful dilators of blood vessels peripherally. This occurs both by the degranulation of mast cells in the skin releasing histamine and also by direct action of substance P, etc., on the endothelium cells lining small blood vessels. The resulting increase in blood flux is detected and measured by a DIODOPP laser Doppler Velocimeter, which registers reflected laser light and whose output voltage is proportional to the velocity and number of moving red cells. The principle of the laser Doppler shown in this diagram is the monochromatic 820 nanometer light from the laser diode penetrates the skin where it is absorbed and scattered. Part of the light is scattered by static structures in the skin, another part by the moving red blood cells, which produces a slight frequency shift due to the Doppler effect. The mixing of Doppler shifted and unshifted backscattered light on the photodetectors in the probe induces intensity fluctuations in the voltage signal. After processing, this therefore provides an output signal proportional to the blood flow. This is transferred to the chart recorder and to the liquid crystal display of the DIODOPP machine. Some evidence of the role of the peptide-containing sensory nerves is shown in this graded series of thermal responses of 4 skin areas, A, B, C and D, to 4 decreasing doses of capsaicin. The photograph is an emission thermograph using infrared thermography. Capsaicin is derived from the hot Hungarian pepper and is a chemical irritant which releases neuropeptides from primary afferent nerve fibres to produce skin redness and a temperature rise, shown here. The stimulating electrodes are placed with a cathode near the laser probe and the Doppler signals are recorded on the chart. Note that the resting flux varies a little with time. Now, applying electrical stimuli of insufficient voltage or current strength will not excite the primary afferent pain nerve fibres, so no skin blood flow changes occur. Only a movement artefact associated with stimulation of large motor nerve fibres. However, if 45 milliamp current pulses, that is 150 volts, 0.75 milliseconds duration pulses at 2 Hertz are applied, then pain or discomfort will be experienced and primary sensory receptors and nerve fibres will be activated. The microvascular blood flux in the skin adjacent to the stimulating electrode is increased. That is, an axon reflex microblush occurs in response to this noxious electrical stimulation. The standard series of stimuli used contains 2, 4, 8 or 16 pulses, given at intervals of 1 to a few minutes. The current in each pulse excites polymodal sensory nerve endings and produces the sensation of discomfort, as well as a blood flux increase, which is proportional to the number of stimulus pulses. Both these effects are decreased if the thin primary afferent pain nerves are impaired or damaged, as illustrated here. These markedly reduced responses are obtained from the skin of diabetic patients. In normal skin, the electrically evoked axon reflex response disappears quickly, and in a few minutes the flux is seen to return to the resting pre-stimulus level. In summary, this electrically evoked axon reflex is a useful measure of neurogenic inflammation, which is thought to be one of the most powerful and important defense mechanisms the organism has against infection. This second part of the program deals with endothelium lining small blood vessels and its role in leading to skin redness. Neurogenic inflammation, which is otherwise called axon reflex vasodilatation, can be evoked by any noxious stimulus. The phenomenon of opening up small blood vessels is the end result of a cascade of events involving three main components, all in series. These are the smallest caliber nerve fibres, that is, the C nociceptors, the microvascular endothelium, and the smooth muscle. Mast cells are involved, and there is also some evidence for the contribution of sympathetic pseudomotor fibres which release acetylcholine. Substances which provoke the axon reflex vasodilatation, such as substance P from the nociceptors, histamine from skin mast cells, and acetylcholine, the transmitter release from pseudomotor fibres, all cause relaxation of the vascular smooth muscles through a common pathway, namely the endothelium. This endothelium in turn releases the endothelium-derived relaxing factor, EDRF, which diffuses into the underlying smooth muscle and subsequently causes relaxation of the microvessels and vasodilatation. The endothelium microscopically is seen as a single layer of squamous cells lining the luminal surface of blood vessels. Endothelial cells have a broad spectrum of metabolic activities. These functions suggest that the endothelial cells, in part, modulate the peripheral blood flow, and hence the integrity of the endothelium is essential for normal function of the organism. Abnormalities in the endothelial cell function occur in disease states such as diabetes, and these can result in disturbances of skin blood flow regulation. Pharmacological tests of endothelium and of microvascular smooth muscle function can be carried out non-invasively by using iontophoresis and measuring the resulting changes in skin blood flow with the DIODOPP. If small direct currents of 0.1 to 0.2 milliamps are applied between skin electrodes to a polar, that is ionizable, water-soluble substance, for example 1% acetylcholine or methacholine solution, then an anodal charge is carried through the epidermis by the acetylcholine or methacholine ions. A battery-powered constant current stimulator provides direct current for the drug iontophoresis. The total dose of chemical injected iontophoretically depends upon total charge, that is, the product of time and current, and also depends upon skin thickness, molecular weight of substance to be transferred, its solubility, and electrical mobility given by the transport number. The increase in blood flux evoked by the endothelium-derived relaxation of microvessels is rapid in onset, lasts only a few minutes, and is dose-dependent. The acetylcholine dose-response relationship, which is displayed here, does show some intra-subject variability from day to day, but this is less than the inter-subject variation. This tests the function of the microvascular endothelium, that is, the second component in the serial cascade. Similar dose-dependent dilator responses are produced by nitrate substances such as sodium nitroprusside, sodium nitrite, etc. These are all endothelium independent, and they act directly on microvascular smooth muscle to relax the vessels and increase local blood flow. Thus, iontophoresis of nitroprusside tests the third series component in the cascade, namely the microvascular smooth muscle. In conclusion, these iontophoretic tests, together with the electrically evoked axon reflex dilator responses, enable neurovascular function in skin to be measured non-invasively in either normal subjects or in patients.